A lesson is only as good as the teacher that is leading it. In order for a neuromuscular training program to be effective, it must include the right exercises. We have provided you with 6 lessons full of neurodynamic warm-up exercises and building skills sessions that will expose your students to exercises that can be used to help teach them to move better. It is the teacher's responsibility to move around the gym, looking for students who are struggling to perform exercises correctly and providing feedback to those students to help improve their technique. Remember, based on our study, we know that only 29% of 12 to 15-year-olds and 21% of 16 to 17-year-olds are able to complete fundamental exercises with proper technique. That means that close to 75% of your students will struggle performing these exercises and will need your feedback to improve their technique. This feedback is what makes neuromuscular training so effective. This next section of the course will teach you how to identify students with poor movement quality and how to provide effective feedback to those students. The first part of an effective neuromuscular training program is including the right exercises. The second component of an effective warm-up is doing those exercises the right way. On the screen, you are watching 2 examples of the same exercise. It takes a well-trained eye to notice if a basketball player is shooting free throws with a proper technique or if a tennis player is serving properly. Similarly, it takes some training to be able to identify which students on the screen are performing the exercise incorrectly. This next section of our workshop is designed to help you identify when your students are performing exercises incorrectly. We will do this systematically by looking at 2 segments of the body during any exercise or other movement. First, let's evaluate the alignment of the upper body segment. Essentially, we are making sure that the spine is properly aligned. To do this, we must be looking at the body from the side. You will notice that, even though the spine has natural curves, when it is properly aligned, we are able to draw a straight line through the ear, shoulder, and hip. As your students go through any lesson, perform this quick evaluation to make sure that their upper body segment is properly aligned at all times. The final part of the body to evaluate is the alignment of the lower body. This should be done looking at the body from the front. To identify alignment of the lower body, simply draw an imaginary line from the hip, through the knee, and to the ankle. You can see that on the left, there is a straight line between the hip, knee, and ankle. The alignment of the lower body on the right, however, is more concerning. This demonstrates dynamic knee valgus, a risk factor for injuries to the lower body, like an ACL tear. As your students go through any lesson, perform these quick evaluations to make sure that the upper, middle, and lower body segments are properly aligned at all times. Now that we've covered the evaluation of the upper and lower body segments, let's practice a bit by looking at a few candid photos of athletes. Look at the volleyball player on the right side of the picture. Because this photo was taken from the front, we will be able to evaluate the alignment of her lower body segment. What do you see? Take 15 seconds on your own to do a quick evaluation. You cannot draw a straight line through her hips, knees, or ankles. This demonstrates that her lower body is not properly aligned. Let's try this again with a new picture. Because this picture was taken from the side, you will only be able to evaluate his upper body segment. Take 15 seconds to look at this picture and perform a quick evaluation. You cannot draw a straight line through the ear, shoulder, and hip. Although his eyes are looking up, his spine is definitely not aligned. When you compare the poor alignment in the photo on the left to the excellent alignment in the photo on the right, it should become much more clear. Let's try this one more time. What do you see? Her joint positioning seems close to perfect here. It was easy to draw a straight line between her hip, knee, and ankle. Now, let's try making it a bit more challenging by looking at some athletes that are in motion. For that reason, let's do our final practice evaluation, this time using the video we watched a few minutes ago. Let's pause the video and see how you did. Maybe you noticed that her knees were collapsing in and out during the video, but it is totally obvious once you look at a still photo. In fact, this photo shows proper joint positioning on her right side. However, the left side tells a completely different story. When an athlete's knees move into this knock-kneed position, forces on bones, ligaments, tendons, and cartilage increase significantly. While some athletes are forced into this position by physical contact, as we know, many athletes suffer non-contact injuries. This is why it is so important for you to regularly perform this evaluation of your students. Let's increase the challenge one more level, this time using the video we watched a few minutes ago. Are you able to identify anyone with poor alignment of the upper, middle, or lower body? Are the girls' bodies stable? Do you see them properly aligned 1 second and in a dangerous position the next? Start by watching just one girl for a few repetitions before moving to the next. Because this video was taken from the front, take note of any reps where you notice poor alignment of the middle or lower body segments. Once you've determined that your students are not in the right position, you need to give them feedback to help correct the issue. Let's go over how to do that. A great coach once said, "If you're not coaching, you're letting it happen." To effectively lead a neuromuscular training program, you must constantly be evaluating your students and providing feedback to help them improve their technique. The same way that you provide feedback to help improve their sport-specific technique, like kicking, throwing, or serving, providing effective feedback during the warm-up will improve their body alignment when they perform fundamental exercises. We hope that alignment will carry over to other lessons and activities. Earlier, I mentioned that neuromuscular training can reduce injury risk and improve performance. Your evaluation and feedback is what can help your students do just that. Without your feedback, it could have the opposite effect. There are two types of cues that you can use to help your athletes improve their technique. The first are internally focused cues. Internally focused cues direct students to focus their attention on a part of their body or the movement. Things like bend at your waist, stand up tall, keep your kneecaps over your shoelaces are all examples of internally focused cues. Externally focused cues direct students to focus their attention on the intended outcome of the movement, sometimes focusing on an external object. Things like push your hips to the wall behind you or lift your head toward the ceiling. Your shins should be perpendicular to the floor are all examples of externally focused cues. Use a combination of internal and externally focused cues and find out what works best for your athletes. Now, let's return to some familiar photos and videos and try providing feedback to the athletes. There are endless possibilities when it comes to providing feedback. Here is your chance to be creative, so play around with different types of feedback. Find cues that work well for you and your athletes. An internal cue, like bring your feet under your hips, might work for some athletes on your team, while an external cue, like rotate your knees out toward the sides of the room, might work for others. Push the back of your neck toward the sky is an example of an externally focused cue that might help correct the alignment of his upper body. Watching this video helps you realize that at any given moment, there's almost always an athlete that needs feedback. Take some time while the video plays to develop some internal and externally focused cues that you would provide to these girls if they were in your class. Neuromuscular training provides safety and performance benefits to your students only if they are performing exercises with the right technique. They cannot do that without your help. Continue to practice evaluating their technique and providing feedback to help those who need it. When your students are healthy and performing at their best, you all will benefit. Now, we will take you step by step through each of the lessons. The lessons in the curriculum relate to these 6 topics: body segment alignment and stability, flexibility, upper body alignment and stability, lower body alignment and stability, agility, and plyometrics.